Let's talk about one of the most fundamental skills in dentistry, the composite restoration. Getting it perfect is an art. But what if the very tools we've been using to learn have been hiding the truth from us? Well, today we're diving into a new solution that's about to change all of that.
I mean, think about it. This is the million-dollar question, isn't it? A filling can look absolutely perfect from the outside, but how do you really know what's going on underneath? Is it fully cured all the way down? Are there tiny voids you can't see? For the longest time, a lot of this has just been, well, educated guesswork.
So, before we get to the new stuff, we've got to look at the old way of doing things. For decades, we've used these traditional training models, dentoforms. And honestly, they've always been a real headache, forcing students and dentists to work around some pretty major problems.
This slide just lays out the struggle. On the left, you've got the classic frustrations. The composite sticks to the plastic tooth like crazy. The material is so opaque, it blocks the curing light. And on the right, that's the dream, right? That's our wish list for what we actually need to learn effectively. Easy removal, light that passes through like a real tooth, and a way to spot any mistake in an instant.
Well, that gap between frustration and the wish list, it's been closed. We are going to walk through a new teaching tool that literally turns that entire wish list into a reality, and it makes mastering composite restorations easier and more effective than ever before.
And you know, this isn't just some random gadget. It was developed by an expert in the field, Dr. Richard Price, over at Dalhousie University, backed by serious research and credibility. So how does it solve all those problems we just talked about? Well, it's got a few innovations. First, a truly non-stick surface. It also transmits light just like a natural tooth. It has a super simple snap-together design, and that means you get instant restoration removal. It's a total game changer.
Okay, so the theory is great, but what makes this thing so powerful is just how simple it is to use in practice. So let's see how all these features come together to create a workflow.
Step 1, you snap the two halves of the tooth together. Step 2, you fill the cavity using whatever technique you want to practice. Step 3, you light cure it. And then, here's the magic. You just open the mold, and the restoration pops right out, totally intact and ready for you to inspect. Okay, you've got your restoration sitting in your hand, but how do you see the invisible? How can you be 100% certain that your light curing technique was actually effective?
The answer is called the acetone test. And this quick little process is going to show you exactly what's going on, revealing things you'd never see otherwise.
And get this, that's all it takes, just 15 minutes. You take the filling you just made, drop in a little bit of acetone, and set a timer. In the time it takes to have a cup of coffee, the full story of your curing technique is going to be revealed.
And here is the key takeaway from Dr. Price's research. This is the big reveal. After that quick acetone bath, any part of that composite that wasn't fully cured gets this distinct, frosty appearance. It's a visual cue that is absolutely impossible to miss.
So, what does frosty actually mean? Well, it's a warning sign. It shows you exactly where the composite is weaker, where it hasn't fully polymerized. In a real patient, this is where failures, microleakage, and sensitivity would start. It's the physical evidence of an incomplete cure that has until now been completely invisible.
And that's really the bottom line. This whole process makes the invisible visible instantly. You can see exactly where your curing light was effective and where you missed a spot. You can see voids you didn't know were there. You get immediate, undeniable feedback on your technique. No more guessing.
So yeah, it's a training tool. But what's the big picture? What does this actually mean for dentists and, more importantly, for patients? Well, the impact is huge. It leads directly to better trained, more competent dentists and a much higher standard of care.
For you, the dental professional or student, this is a chance to really dial in your skills. You can finally perfect your curing technique. You can practice until you can eliminate every single void. You can even test different curing lights against each other to see which one works best. It's all about building absolute confidence in the restorations you create. But you know, this is why it all matters. Because that confidence, that perfected skill, translates directly into better outcomes for your patients. It means fillings that are stronger and last way longer. It means fewer failures, fewer repairs down the road, and ultimately, it just means a higher quality of dental care for everybody.
Thank you for watching.